Hi friends, welcome back to my channel. My name is Chris and I am a dermatology trainee based in Glasgow in the UK. And on my channel I share my life experience working in dermatology as well as my journey towards becoming a consultant dermatologist in the UK. I realized that a lot of people don't really know much about dermatology and what dermatologists do on a day-to-day basis. And I think primarily the reason why this is so is because we don't have much exposure through medical school and during foundation year training in dermatology. And as such, in this video, I'm going to debunk a few myths when it comes to people's perceptions on dermatologists. The first myth that I would like to debunk is that dermatologists are lazy and they sit in their office and drink tea and coffee all day long. Whilst it is true that we love drinking our teas and coffees, and some of us even got our own coffee machine to make our own nice coffees, working in dermatology can be very busy. Now, dermatology is an outpatient-based specialty, so we primarily deal with patients in clinics, and a lot of the time we see over 30 patients in one clinic setting, and sometimes we have back-to-back clinics on top of on-call duties. Sometimes we have clinic sessions both in the morning and in the afternoon. And if clinics from the morning overrun, we might then end up not having lunch break and going into the afternoon clinic straight away. And this is not counting in the time taken for us to do admin before and after clinics. What I mean by admin is dictating and verifying clinic letters, signing them off, chasing investigation results, and sometimes if the results come back as abnormal, then you will need to write to the patient and act on these abnormal results. And these all can take quite some time because the patients are not in front of you. They are away in their own home, and so you've got to contact the patient either through a letter or call them. And also, if it's something more urgent, you might need to call the GP practice at the same time. Other than doing clinics and administrative work, dermatologists find themselves busy with other things, including doing on-call shifts and surgical lists where they operate on patients with suspected skin cancer or rashes which need a histological diagnosis. Dermatology is also a very academic, research-oriented specialty, which means there are tons and tons of meetings almost on a weekly basis. Actually, it is on a weekly basis. There is always something that comes up each week. It can be from a clinical meeting where we discuss patients, pathology meeting where we discuss pathology slides with other dermatologists and pathologists, research, audits, regional meetings, clinical governance, journal clubs, so on and so forth. I have to say, sometimes I end up finishing at 6 or 7 o'clock, even though I'm supposed to leave at 5, simply because there is so much work behind the scenes and even during clinics that we have to do for our patients. So for those of you who think that dermatology is a very relaxing specialty, you might want to think again because it is very academic, outpatient focused specialty where you see a lot of patients in one sitting. The next myth that I would like to debunk is that we don't just see patients with suspected skin cancer or with acne vulgaris. Dermatology is such an interesting specialty because it is very visual. We don't just see skin cancers, we see other types of skin lesions, be it benign or malignant, and it's not just basal cell carcinoma, squamous cell carcinoma, and melanoma. There are tons and tons of different lesions out there for us to diagnose. And when it comes to dealing with skin conditions, it is not just acne we deal with inflammatory skin condition, which is our bread and butter in dermatology, primarily eczema or dermatitis, as well as psoriasis. We also deal with things like lupus, blistering skin conditions like bullous pemphigoid, pemphigus vulgaris, and a wide range of inflammatory skin conditions. And in dermatology, there is always something new to learn. Nothing is black and white like in the books. So what you see today might look different for another patient, and it's always something that keeps you on your toes. One good example would be the various dermatological presentations you see in patients with COVID and even patients who have had COVID vaccinations. There is a wide range of differential diagnosis when it comes to dermatological presentations. And as a dermatologist, you feel like you're a detective finding all the clues and narrowing it down to the right main differential. I have to say, I always feel a sense of pride and satisfaction by making a spot diagnosis that other people just couldn't. And as a dermatologist, when seeing patients in the wards, you are able to help the general physicians to narrow things down, either by saying this is what it is, or by doing a diagnostic biopsy. The last myth is that we don't see patients out of hours. This is definitely a myth because I do dermatology out of hours in the west of Scotland. And what this means is that we cover from 5 p.m. in the evening to 9 a.m. the next day on a normal weekday. And for weekends, it will be 9 a.m. on Saturday to 9 a.m. on a Monday. I have to say, not all regions across the UK do provide dermatology out of hours, but in the west of Scotland, we do out of hours on call, and I do answer calls and sometimes have to go in to see patients either in A&E or the medical receiving unit. Out of hours for dermatology is primarily done as a non-resident on call, which means we would not be on site unless we get called. So what I normally do is I would go home, do my own usual things, and if I do happen to get called, I will answer, and depending on how severe the situation is, I may or may not go in. Dermatology on call is actually quite interesting because you never know what you would get called about. I remember being called to see an infant, to a pregnant woman, to an elderly patient all in one day. Most of the time, it is quite straightforward. Patients are quite well, so you don't really need to go in. But on some of the occasions, I did have to go in, and you have to sometimes even do a biopsy out of hours as well. So there you have it. These are the 3 myths that people think dermatology is that I would like to debunk. I hope you enjoyed watching this video as much as I enjoyed making it. If you like this video, do check out my other videos where I talk about managing common skin conditions like keratosis pilaris, rosacea, viral warts, so on and so forth. Thank you for watching once again. See you next time. Bye.